Spine range of motion, cervical flexion. Have your partner sit with their head in a neutral position. The axis of rotation is the external acoustic meatus. The stationary arm is perpendicular with the ground, and the mobile arm is aligned with the nose. Normal range of motion of cervical flexion is 50 degrees. Ankle foot range of motion, ankle inversion. Have your partner sit with their knees bent and feet hanging over the edge of the mat table. The axis of rotation is the midway point between the medial and lateral malleoli along the talocrural line. The stationary arm is aligned with the midline of the lower leg, and the mobile arm is aligned with the second metatarsal. Normal range of motion for ankle inversion is 30 degrees. Elbow range of motion, forearm supination. Have your partner sit with their elbow bent at 90 degrees of flexion. Their forearm should be in a neutral position with the thumb pointed at the ceiling. Have your partner supinate their forearms so their palm will face the ceiling. The axis of rotation is medial and just proximal to the ulnar styloid process. The stationary arm is an imaginary line perpendicular to the floor and parallel to the humerus, and the mobile arm is laying across the wrist joint or the distal radial ulnar joint. Normal range of motion of forearm supination is 90 degrees. Knee manual muscle test semimembranosus. Have your partner lie prone on the mat table with their knee flexed just under 90 degrees. Have them externally rotate their legs so their toes are pointing laterally. Place both hands just proximal to the ankle joint and resist their knee flexion with downward force. Spine manual muscle testing quadratus lumborum. Have your partner lie supine on their back, holding the edge of the mat table with both hands. Grasp one leg just proximal to the ankle joint, and have your partner hike their pelvis towards their ribs. Pull down on their leg. Shoulder manual muscle test posterior deltoid. Have your partner lie prone with their shoulder on the edge of the mat table at 90 degrees of abduction with elbow flexion. Stand at the side of the arm being tested. Place one hand just above their elbow joint at the distal humerus and the other hand stabilizing the shoulder. Instruct your partner to drive their elbow towards the ceiling while you resist in a downward direction.